designing the program, started looking at hurdles and challenges that this segment of the market and population is dealing with. And, you know, I had people throw out, oh, well, you know, one of the biggest things is Alzheimer's. And with that, I immediately thought, well, we're at CES. Well, where do Alzheimer's and technology converge? And is there anything that is being done with technology that can not only help diagnose, but also help maybe in the treatment and or management of Alzheimer's? So I was really fortunate to be talking to a good friend of mine, and met Ellie and heard about what they're doing, and I thought, oh, finally I get to address Alzheimer's at the show, and in a really positive way. So, and then fortunately, I got to meet Claudia Williams from the White House, and we're really, really lucky to have her here to really talk about this extremely important discussion around how can technology help those dealing with Alzheimer's and their caregivers. So I want to introduce you to Alexander von Plato, the President and Global Chief Creative Officer from Digitas Health Life Brands, who will be running this session, leading the session and the discussion. Thank you.
Thank you. Can I do it from here? You can hear me from here. So I tweeted this morning, we'll see if CES is ready for a very, very serious conversation about the role of technology in Alzheimer's disease diagnosis and treatment and prevention. And so we're excited to really address something of this magnitude. And I could regale you with a lot of statistics, but first I want to introduce you to our panel more completely. Ellie Kaplan, who's had stints in the Clinton administration, in the US State Department, at Goldman Sachs, has her MBA from Harvard, has taken her considerable expertise and passion and focused it on the diagnosis of Alzheimer's disease at its earliest moment of appearance at this stage as we know it. And her company, NeuroTrack, is inventing and has created a diagnostic tool that we believe is going to change not just the way people understand when and how Alzheimer's manifests itself, but it's going to change the way research and development gets channeled to look at earlier stages of the disease. And sitting next to Ellie is, as Jill just told us, is Claudia Williams, who is, her title is Senior Advisor of Health Innovation and Technology at the White House Office of Science and Technology. And Claudia is another triathlete with deep experience in the private sector, in the public sector, in the not-for-profit sector as well. And she's just passionate about building the collaborations between the public sector, government, and this space of emerging technology and entrepreneurs, and really helping to make those connections and that encouragement happen to bring this technology to bear sooner and more dramatically than we would see it without government intervention. So welcome to this conversation. And to get us started, I'm going to play you a video from the Alzheimer's Association site that just gives you an idea of the magnitude of Alzheimer's disease in the world, how many people are going to be affected by it. Half of all of you will be in this room. All of you will know somebody who is and will have a loved one. So 100% of you will be impacted, and 50% of you will be diagnosed if you live to your 80s. So pay some attention to some of these statistics, and then we'll get talking. Roll it, Pat. So I think that does a nice job of emphasizing what a devastating human and societal issue Alzheimer's is. And Ellie, you're really focused on the diagnosis, looking at it completely differently than we currently do and looking at it much earlier. Tell us more about your company.
Sure. So one thing that we know is that Alzheimer's disease starts in the brain 20 to 30 years before their symptoms. So by the time you reach the point where you have symptoms, it's too late. There's nothing you can do about it. Pharmaceutical companies are desperately trying to develop drugs that we call disease-modifying drugs, so drugs that are preventative or curative. But they've been challenged by the fact that there hasn't been a really effective early diagnostic tool to help them identify the people who they need in those clinical trials. So people who we know have the disease, who will convert at some point in the future, but who don't yet show symptoms. So our technology does just that. It was developed by a group of neuroscientists, clinical neuropsychologists, computer scientists at Emory University. And our lead inventor was part of the team that actually made one of the very first critical discoveries in the area of Alzheimer's, which is that the hippocampus is the first part of the brain to be impacted by Alzheimer's. And he really sort of followed up on that, pulled on that thread for 20, 25 years in order to develop this technology, understanding that we needed something that could find impairment very, very early on. And we need it in a way that was very easy to scale. He's a really brilliant man who's very visionary. And so he began working originally in non-human primates to develop what is now a computer-based cognitive visual test that relies upon a person's innate preference for novelty. So we are all born with this instinctive desire to look at things that are new.
Hence CES.
Hence CES, exactly. And we use that to track what's called recognition memory, which is the memory process that's housed in the hippocampus, first part of the brain to be impacted by Alzheimer's, and be able to give a very, very early read on potential impairments, microscopic impairments that exist there. And these are impairments that in many and most cases are not discoverable even by very invasive means, so PET imaging. So that's what our technology does. It's, as I mentioned, it's a computer-based test that uses eye tracking, either over the web or using an infrared piece of eye tracking hardware to track your eyeballs and watch how you view images on a computer screen for a period of 4.5 minutes. And we collect all that data, analyze it, and then can give a prognosis. And so what we've found is that if you score poorly on our test, there's a 100% chance that you will go on to convert somewhere along the trajectory for Alzheimer's disease in the next 3 to 6 years. And if you score above a certain number, 67, there's 0 chance that you will convert in the next 3 years. So we believe this is a really incredibly powerful tool that can be scaled very easily because it's on the computer and can be delivered on your iPad or a laptop. That will create enormous impact and value in terms of preventing and ultimately developing drugs to treat the disease.
Talk a little bit about the research study that you did to develop it, the multiple-year study.
Right? Yeah. So the original study, I mean, as I mentioned, a lot of the work began in monkeys many, many years ago. They got great success with that and ultimately put it into a human subject trial. It was a 5-year longitudinal study that was conducted at the Alzheimer's Disease Research Center at Emory University. And they had a cohort of people, the majority of which were healthy control, so people who showed no symptoms of Alzheimer's disease. And we tracked them over a period of 5 years. And we gave them the test every year, along with lots of other tests that, that are currently used, memory tests, blood tests, imaging tests. And what we found was that people who, scored very low on our test went on to convert. And we were able to discover this by, having an army of neuroscientists and clinical neuropsychologists who would then do what they call consensus clinical diagnosis. And we now have studies running all over the country. We have a really big one running in China to continue to validate the technology. And we're working with pharmaceutical companies to help them better identify individuals who are pre-symptomatic, but who we know have the disease and who will convert at some point to test these drugs.
And that's a big connection, I think, of our interest in your technology and what you're doing, because we're trying to help the pharmaceutical industry identify the kind of partners that they can work with in this emerging technology space. And if it becomes a catalyst to get them to move research and development to earlier in the disease occurrence, I think we're going to have a tremendous sea change in the way we look at this disease from a research standpoint.
Absolutely.
And it's very exciting.
Yeah, absolutely. I mean, you know, what people call, and we talked about this a little bit earlier, what people call, you know, early onset Alzheimer's, at that point you've been diagnosed with something, so you're displaying some level of symptomology, and it's too late. So there's nothing that you can do from a pharmacological perspective to treat the disease. You can treat the symptoms with certain drugs, but nothing to actually stop the progression.
I think I likened it to waiting to diagnose depression until there's a suicide attempt. You know, that there's now a diagnostic protocol that gets people diagnosed with depression and treated for depression, and we believe we're avoiding many, many, you know, fatal and disastrous outcomes of untreated depression because we get people treated. So why wait? If we wait till people already are manifesting Alzheimer's, our ability to actually impact the diseases lessens so greatly. So it's very, very exciting that there's an opportunity to see this earlier and earlier. Claudia, from a government standpoint and the impact, you know, societally, because this is a medical problem, but it's a huge social, economic, you know, bringing, you know, the healthcare economy to its knees problem. Tell us how the White House is getting involved and why they're looking at Alzheimer's.
Sure. And let me actually, I don't know how many of you are familiar with the CTO's office in the White House? Todd Park, okay. Megan Smith is our new CTO. She's actually speaking this afternoon at a Maker Girls event. But our role within the White House, it's a very new function. Anish Chopra was the first CTO named by Obama. And really our function is to be the innovation skunk works within the highest levels of the executive branch. And that both gives us a way, if you think about the pen and the phone, right? These famous tools that we have, even when there's not congressional action, to highlight critical national problems. And most importantly, to continue a conversation with tech innovators. We see our role as bridging between our government policies and the folks like you that are actually creating and inventing new products, and to bring that same caliber of tech talent into government so that the tech tools and the information tools we have in government are just as good as in the private sector. And I can talk a little bit more about that later. We're actually in a massive recruiting effort right now that Todd Park is leading. After healthcare.gov, one of the recognitions was if we don't have the best tech talent, there's no way we can develop even good websites. So we have folks coming in from Facebook, from Google, from Twitter, from other organizations to really be our leading stars right now. So if you're interested, let me know.
Trying to get you guys off floppy disks.
Yeah, in fact, I am not so certain there may well be floppy disks. That was a bit, you probably saw the article in the New York Times this weekend, right? Yeah. I actually want to take this from a slightly different angle. Obviously, Alzheimer's and aging in America is a huge health challenge facing our nation, facing our healthcare delivery system. Eric Dishman likes to say that pretty soon, for the first time in the globe's history, we're going to have more people over 65 than young folks. So China is just as important a player in this as the United States, and in fact more so given that many couples are supporting 4 elder parents. But here in the United States, Alzheimer's, they're the patients and the folks we need to catch early. But an incredibly important component of what we need to look at is the nation's caregivers. There are an estimated 66 million caregivers providing almost $250 billion worth of economic value. This is a workforce that's larger than any other healthcare workforce, more wired than the average folks, and has more back injuries than minors, and that's coal miners, not our kids, right? So there's this incredible engine of activity out there that's very stressed. and very much in need of tech tools. And many of you, I for one don't have any, I have 2 older parents, neither of whom live close to me, both of whom I would very much like to support actively while I'm working, while I'm caring for my own kids. But frankly, I do not have the tech tools to support them. Now, we think a lot at this conference about sensors and wearables and smart homes, and those are incredibly important. But it's also important to think about services like finding what the services you need in the community, daily living tasks, lifting up, going to the bathroom, taking a shower, and imagine the combination of the smart home with simple tools and services that let you do these things more simply and better. And we would alleviate an incredible amount of anxiety and stress and, frankly, wasted time on the part of caregivers. I do think it's important to remember that it's often very quickly that technologies bump up against the need for additional human services and for wraparound to make things easily adoptable. So if any of you are in the business of creating tech tools in this space, it's super important to engage with providers and with the community folks and the family members who are actually going to be the onboarders of these technologies, because seldom is there someone that can just take and move that technology into the home. But I really want, as we move into this year of, we have a decennial conference on aging that the White House sponsors along with HHS, the critical importance of supporting caregivers with tech tools and with innovations. I just want to make sure folks are aware of that and engage in that area.
So we saw a couple analysts estimate that the elder care tech sector is pegged at $20 billion by the year 2020. So this is a real business opportunity, and that's another exciting intersection is how to bring technology to bear that create real business opportunities for entrepreneurs on such important issues. I walk around the floor and I see a lot of ways to track how many footsteps I take or how many calories I eat, and certainly obesity and fitness is a huge, important health issue. But when you're looking at these kinds of disease states, there's a tremendous opportunity, and here we're talking about not only with the patient population themselves, trying to get them diagnosed and treated, with the caregiver population, which is as big or bigger than the initiating patient population. So that makes this a very dramatic and sizable opportunity for technology entrepreneurs to get involved and really make a difference. I guess the other area, and we talked about sensing, so the tech, that's around caregivers. There seems to be a lot of sensing technology in this whole smart home elder care tech space, where people are able to keep an eye on, if you will, their loved ones from a remote location. And we're seeing technology that actually establishes the pattern recognition of what your grandmom or your mom might do all day, when she generally gets out of bed, when she generally takes a shower, how many times she leaves the house, and can track her activity and alert you when those patterns change. So if she hasn't gotten out of bed by noon, or she spent 25 minutes in the bathroom and she doesn't ever do that. Things that are about leaving the stove on, leaving the back door open, not turning off the car, turning on the car. So we're starting to really see traction. We tried to get SmartThings to join us today. If you're not familiar with SmartThings, they were a Kickstarter company that Samsung bought for about $200 million, I think is what's reported earlier this year. And they're such a darling at CES that they're like keynoting everywhere, and they couldn't join us. But you'll walk out on the floor and you'll see a lot of what was originally like fitness tracking, sensor, smart home technology now being aimed, at this space. And, we think, it has the potential to be really effective in doing what you just said, which is supporting this caregiver burden. The other area that we were talking about when we were talking about the intersection of technology and Alzheimer's was memory support. How is technology actually being deployed to help people improve their memories? And we all see the Luminosity commercials. Mm-hmm. I can't believe that they make that much money, that they can advertise that much. But what do you see in terms of the things the tests that people take and the games that people play and the apps that are being deployed. You must be looking at this space a little bit.
Yeah, we do. We look at it a lot. And the science doesn't back up any of those apps. The science says that you can play certain games online all day, and it may help you get much better at the game, but it doesn't actually, unfortunately, improve your memory. What does actually improve your memory and improve or keep stable your cognitive skills are things like exercise and changes to your diet. And those have been shown to be very, very effective. In fact, there was a study that the Alzheimer's Association announced, or the study findings were announced at the big Alzheimer's conference last summer, called the Finger Study, which was like a 20,000 subject study out of Finland that showed that people who had what they call subjective memory complaints, so really were experiencing significant memory issues, when they implemented an exercise regimen that was, that was very sort of diligent. So that every day you're going for a walk, or 4 out of 7 days you're going for a walk, or you're getting on your elliptical or whatever. Those people actually showed to have improvement in memory. So I think one of the big issues, and it's something that I think some people are familiar with, is, and that you have to be very careful about in this space, is just understanding what's backed up by science and what's not, and being very aware, as we are all beginning to deal with this issue, about what works and what doesn't, that's sort of the position that we take. We know that there's a lot that you can do to improve your memory, even in the absence of a therapeutic. And there's actually a lot that you can do to prevent early onset, again, with exercise and with diet. And we're starting to see a shift in terms of the medical community really focusing on prevention. And in fact, there's a physician whose name is Richard Isaacson, who just opened the first Alzheimer's prevention clinic at Weill Cornell Hospital in New York City, and his doors have been flooded with people who are not in their 60s and 70s and 80s, but in fact who are in their 20s and 30s and 40s. There was a similar clinic that was started at Cedars-Sinai in LA. And what people don't realize, I think, is sort of where I started. It's amazing, and it's also fantastic, because it's this sign that there is actually a lot that we can do that is in our control to prevent the disease, to help us along the way, starting now.
I want to talk a little too about research and think about the data that we're going to need if we're really going to look at these problems in this kind of holistic way. So we've talked about diet, we've talked about eye movement, we've talked about sensing in the homes and habits, and we all know that we may, even if you're sick, you may only see the doctor 5 times a year, 3 times a year, 10 maybe. The proportion of your time that you spend in the doctor's office is minuscule, and that represents everything in the medical record, right? The blood tests, the blood pressure, the questions about your behavior and your family support. And if we are really to come up with better treatments and ways of integrating the technologies with the evidence to make sizable improvements, we're going to need boluses of data that include home sensor data, that include wearables data, that includes microbiome data, that includes food diet and food diary data, exercise data, medical record data, claims data, right? We simply today do not have a framework for doing the kind of big data research for what should ultimately become precision medicine. And an incredibly important area for us as we look to the next year is to ask ourselves what kinds of investments, what kinds of policies, what kinds of initiatives might support the aggregation of data on patients, with patients driving that agenda and actively participating in that work in a way that's very, very different from previous NIH grants and studies. So I just think as we think about we're not going to be able to help you, support you in marketing your product without the evidence of what works. Government is one of the major, if not by far the biggest funder of the evidence base. But we're going to need to band together in very different ways. And a lot of times patients are the only source of those kinds of data in ways that are kind of unimaginable when you look at historic research efforts. So precision medicine, how do we aggregate big data that come from these diverse sources? How do we have patients in the driver's seat of that kind of research agenda? Patients are impatient. They are sick and tired of a research effort and an evidence-building effort that's moving at a glacial speed. We need to help provide the treatments and the new breakthroughs by, I think we've all seen a lot of businesses that are really profiting from patients' data, but not in ways that are sharing that across the enterprise and really speeding up discovery. So we need to figure out how to break those silos and move forward.
That's like a brick to forehead moment, from my perspective, because what are people doing now that they didn't do 4 years ago, tracking their activity? What is all this technology right now has been deployed commercially for mostly in the fitness space, but how can that be converted to be a data feed? Because they're doing it, and they have it, and they like doing it, and we see people showing up for research projects to actually prevent Alzheimer's disease, to do fitness regimens. We've seen the shift in fitness where people do it for vanity. That's the biggest driver. I need to lose 10 pounds because I have a class reunion coming up. But then we also know that there's a lot of people who want to prevent heart disease, or know they have a family history, or trying to keep themselves fit. When you add mental health to that fitness obsession, it creates a whole new set of opportunities to track and to unlock the patient data in a way that right now people don't think that their personal data, that's their personal data. They think their personal data is locked in their health record and it doesn't belong to them, when in fact they're generating reams of data that needs to be integrated.
And just, I get a bit on a hobby horse on this issue. Patients, you own a copy of your data. That's your HIPAA right. What we need is ways that you can take that and share that. Like, what if I could share that with a company that was actually developing tools around a genetic marker that I had? That would be amazing. We've also seen that patients are very concerned with privacy, but they are more than willing to donate their data for research purposes, as long as they sort of have an understanding and that they're included in the conversation. So I think we need a different social compact with patients around their own information, how they can contribute that and have that be fueling better products and services in the future. I think we get a little gun shy about it because we, of course, want to protect information. Of course, we don't want any kind of security or privacy breaches. But the patients I talk to, especially those with rare diseases, and especially those with genetically informed diseases, they're kind of sick and tired of a research enterprise that's not supporting them and moving more quickly.
Absolutely. Yeah, no, I couldn't agree more. I think we're at this great moment in time, and it's going to take all of this. This disease is going to require all of these different aspects committing to finding a solution and to contributing, data and information in order to really understand what's going on and how we can better treat and prevent the disease from going any further.
So let's talk about the regulated environment, because we work with a lot of health startups and incubators. We work around Rock Health as well, and we see a lot of people trying to skirt it. They don't want to have to go through the FDA. They want to be able to do a commercial product, go straight to the consumer, and not have a regulated. What you guys are not doing that.
We're not doing that. No, it brings value to the company, frankly. If it's required, there are certainly things that are not required. But for us, giving an early diagnosis of a disease like Alzheimer's, it's required, and we see it as something that brings value to us going through the process, and ultimately, we're not there yet, but ultimately getting approval, and then being a grown-up at the table in a physician's office and a validated test that everyone has endorsed as having legitimacy. There's no, for a company like ours and a technology like ours, there's really no way around it. And I think, we have seen that trying to find ways to get around it does not serve you well.
Claudia, how do you feel about that?
So, I think a key area of interest for us in the CTO's office as that bridge between innovators and government is to help our agency brothers and sisters figure out how to be more innovative in their regulatory approaches in ways that both protect consumers, build a strong and vibrant marketplace, and build products and services that are going to serve Americans. So I would completely agree with what Ellie said, that when you're diagnosing a disease, you and I would both want that to have gone through a review process. I don't think anyone would want a product that they didn't have confidence in. But I'm sure many of you are aware of the mobile medical apps guidance that the FDA put out, where it said, listen, there are a set of low-risk, consumer-facing mobile medical apps, things like tracking, of like a dietary tracking or other kinds of tracking that aren't seeking to diagnose, aren't seeking to treat. Sure, there's going to be gray area, and we have to figure out what that is. But in those areas, we are not going to regulate. And you know what? There was a lot of debate, I will tell you, before that went out, because some people are like, oh, that's going to put a pall on the industry. And our point was, no, it's not. People are already shying away from areas where they're not sure if they need to seek FDA approval. So one of the things that we're really encouraged by is where agencies try to be more clear about what they are and aren't doing, and for lower risk kinds of enterprises saying, for now, we may ultimately need to act in this area, but right now we think, go ahead, you don't need to go through the regulatory processes. There's also, I think, an important, there are some spaces that are really new. Drones would be an example, where we don't know how to regulate yet. We should, I think ultimately we're gonna have to, but it's, regulatory processes typically take 1.5 to 2 years. And so we're all gonna have to think on our feet together about how we move into these spaces where the technology is moving more quickly than our tools can. And are there ways that we can develop more flexible approaches to regulation, not build all the requirements or all the definitions into the regs themselves, rely on third-party entities that might be able to track more quickly. We see this in standard spaces too, where if you build a standard into a reg, and guess what, the world evolved, and 5 years later it's a new standard, you're stuck. So we're always on the lookout for ways we can move forward that allow innovators to do their incredibly important work while playing the role that only we can play, which is being the last stop for protecting consumers. And that frankly builds up a strong industry for you and builds up the kinds of marketplaces that consumers are going to feel happy purchasing products in.
Yeah, we're already seeing it with the FDA as it relates to Alzheimer's.
Yeah.
I think the nice thing is that the FDA, when there is a pending public health crisis,
yes.
They do tend to act more quickly. And so they've already put out some guidelines fast tracking
Yes.
early diagnostics and early stage medications. I think they're very focused on finding solutions and working with companies to get to those solutions quickly. I mean, they still have to be validated, obviously, but I think that there is an attitude that we've got to work together in order to address this crisis.
So one issue I also wanted to raise that relates to the government role is, how is payment policy going to support the kinds of technologies we see emerging? And one of the questions I often get asked is, when is the government going to pay for XYZ, like for a home tracking device or smart homes? And I think that's a really good question, and it's absolutely true that we need to start moving payment away from the bricks and mortar, as Eric Dishman calls the mainframe medical establishment, right? At the same time, we need to do it in an environment where what we're paying for are the outcomes. And we're not, because honestly, if we were going to pay for Fitbits tomorrow, lots of people would get Fitbits, but we wouldn't necessarily be any closer to a healthier society, right? So payment approaches like bundles, like ACOs, and even like the chronic care payment that was put into the fee-for-service regs last year that actually for the first time will pay for a package of services for care management, remote monitoring, and tracking, and 24/7 care. These are the things we should be looking to and speeding up, frankly, both through government action and through other payers stepping up to the table. So I would love to see companies obviously playing, I think I'm not sure to what extent this space, the wearable space, sees an ACO directly as a client, because I think there's a bit of divide between what happens in the home and what happens in the medical establishment. But one of the encouraging things I see is programs like what Dignity Health is doing called Greenlight. And they're essentially saying, listen, we're going to name 3 major issues that we want tech innovators to come up with solutions around. Maybe it's asthma or COPD or hypertension. Come forward if you have a new product and service, and we'd like to set up a much more formalized way to test the impact of that service in the actual medical outcomes and medical services that are delivered. Because payers aren't going to be able to start moving towards better payment policies without more evidence. So we desperately need innovators to pair up with providers and families to actually generate the evidence that will allow payment policies to change.
And a lot of the things that we see is this treatment plus the program that goes with it, and how the technology-based program that supports behavior modification or supports certain lifestyle changes is actually part of the treatment protocol. So to get back to the idea of bundling, it's a pill and a program, it's a process, it's been tested together, and it's been brought forward as a more complete solution than just a pharmaceutical solution or just an off-the-shelf technology solution. So how those things get brought together, and the pharmaceutical industry, we know, is looking very carefully at those kinds of partnerships and those kinds of alignments. I want to talk a little bit before we close about advocacy, though, because this is you said the word crisis. The FDA's getting pretty good about a crisis, about fast-tracking things. I don't think we are in touch with the level of crisis we're on the verge of here. We're actually in the middle of. And part of the reason why is because the people who are sick can't agitate for themselves, can't agitate the system. HIV treatment changed because people got up and got mad and marched that there was unfair discriminatory treatment of gay men with AIDS in the early 80s, and they forced the pharmaceutical industry to do something about it. We see breast cancer, we see heart disease, the red dress, we see these platforms. But here we have a patient population that can't speak for themselves. And quite frankly, I know this is something you've said, and it resonates because I have friends here in the audience today who've lost their loved ones to Alzheimer's. And that is, after you bury your parent, you're exhausted. It takes 10 years to lose your mother. It doesn't take 10 weeks. And the hospice system isn't set up for it. So what do we do? Is it caregivers? Like, how do we get the advocacy and the vocalization of the crisis to happen? Because the Alzheimer's Association is doing a wonderful job, and there's lots of grassroots, but it's not visible enough, and it's bigger than breast cancer.
So I have given a bunch of talks, and at one of them, this Wired talk, I wanted to walk out with a sign around my neck that said, I have Alzheimer's disease. Because I probably do. I had it on my mother's side, and I had it on my father's side. But I don't yet show symptoms. I mean, I'm in my early 40s, and I, probably am years and years away from it if I get it, if we don't find a cure first. And my board was like, are you out of your mind? You're running a company. You can't walk out there and tell people you have Alzheimer's disease because you don't. Well, I don't look like I do, but I probably do. And I think that what we need is younger people, the people who are going to this clinic in New York, who have the ability to go out and close down the FDA and close down the NIH, which is what the ACT UP group did with HIV/AIDS, and say, enough is enough. We have run a lot of statistics, and I know it's less about the administration than it is about Congress, but I tend to go a little nuts about this because it's so deeply upsetting to me. if you look at funding levels for Alzheimer's disease by the US government, it is appalling. HIV/AIDS levels, and I am in no way harping on this community. I think, if anything, they are a shining example of what can be done. If you look at levels of research dollars spent on a per death basis, HIV/AIDS today gets $350,000 per death. Alzheimer's disease, which is on the verge of bankrupting sovereign nations around the world, gets $1,000 per death. So there's no way we can make any kind of progress with those levels of funding. And I think it's our responsibility, people in this room who have the ability to understand that we are all going to be affected. It's not going to be tomorrow, but it's going to be soon enough, and it'll be sooner than you realize, to go and tell your congressman and tell your people in government that it's got to change. That's my soapbox.
I count myself as an e-patient, and I have a lot of friends like Dave DeBroncard and Regina Holiday and Brave Bosom. She's somebody with a BRCA gene, and Erin, whose son has CF. And what I see is an incredibly powerful movement of patients stepping forward and saying, nothing without us. We need to be included. And for instance, Andrea, Brave Bosom, has collected a bunch of BRCA data. She will sell it to the company that's going to do the most research. So I completely agree that we need funding that matches the problem. And I really think that maybe, and I think galvanizing patients as a community, they're a little bit split by disease, to say, let's do the funding, let's not hoard our data, let's openly share the results, and let's get going with the treatments that are going to save our lives is what we need.
You know, there's another piece of technology that we didn't talk about, and it's one of my favorite pieces because it's communications technology and it's media. I want to play you a little video, and I think I learned more about the impact of Alzheimer's disease and how any human being can make a difference from this clip that somebody put on my Facebook page last week than I ever knew before. Pat, you want to roll that?